you had your mother go through a situation that actually is a perfect case study and story to talk about the concerns of healthcare. So I'm just going to tee it up, hit it off, and you're good to go.
Absolutely. So my mom, she was a pharmacist before she retired, and she had been with the same company for 25 years. And she was getting to the age where she was seriously considering retirement, and she had a plan in place. She knew that if she retired, that this company was going to allow her to stay on their health plan until she hit Medicare age, and then she could switch off to Medicare and be able to live through retirement that way. They were also going to allow my father to stay on that health plan until Medicare age because he was self-employed. So they had this whole plan in place of how they were going to have health insurance through their retirement years until they qualified for Medicare. And then she got a letter in the mail that totally derailed all of that. She got a letter in the mail that said that this company was no longer going to allow retired employees to stay on the healthcare plan. So this whole plan that she had in place for her and for my dad to be able to retire when they wanted to was totally derailed, thrown off track, because they hadn't planned to be taking out all of this extra income from the assets that they had saved to be able to afford another kind of health insurance outside of the plan through her employer. So that really pushed her back. And she was thinking, I'm not gonna be able to retire now. I don't have a plan in place to take out the assets that I would need to pay for some other kind of health care that's going to be outrageously expensive. So I'm just going to have to keep working. It turned out that she ended up getting another letter in the mail that said, hey, if you retire by November 30th, which would have been like the next 2 months, then we will allow you to stay on the health insurance plan, give you a stipend to help pay for that. It's still going to cost you some money, but it's better than having no option at all. But if you retire by then, we'll allow you to stay on it. Mm-hmm. So she was afforded this small blessing to be able to stay on the health insurance plan so she could go through with her retirement plan. But that is definitely not the case for a lot of the people that we take care of that are getting towards retirement that don't necessarily have a plan of how the heck they're going to get to Medicare age.